events, NeuroConnect. Together with eminent experts in the field, we aim to support and empower both neurological patients and caregivers in their fight against the disease. Today's focus is on paying attention to early symptoms of Alzheimer's. Alzheimer's is a progressive neurological disorder that affects memory, thinking, and behavior. It is essential to pay attention to subtle changes in cognition and behavior as they could be early indicators of the disease. Memory lapses, confusion, difficulty completing familiar tasks, language problems, and personality are some of the warning signs to be mindful of. As we explore this crucial topic, our goal is to create awareness and enhance understanding of the early warning signs of Alzheimer's, which are often overlooked and misunderstood. By recognizing these early symptoms, we can take proactive steps towards early detection of the disease, as well as better management of the disease and improving the quality of life for patients and their families. Throughout this session, my colleague Dr. Dinesh will shed light on the importance of early detection, the significance of seeking medical evaluation, and the support available for those affected by Alzheimer's. Let's come together, learn, and empower ourselves and our loved ones in the fight against Alzheimer's disease. Before we move forward, I would like to share some insightful facts about Alzheimer's disease and provide a comprehensive overview of the existing treatment options for this challenging condition. So, first, I would like to take you through few facts of the Alzheimer's disease. As per the analysis that was done by Alzheimer's Association, more than 6 million Americans are living with Alzheimer's, and this number is expected to reach almost 13 million by 2050. Similarly, more than 4 million people have some form of Alzheimer's in India, and almost 44 million people around the world are living with dementia. It has been analyzed that 1 in 3 seniors die with Alzheimer's. That is more than breast cancer and the prostate cancer together. Only 4 in 10 Americans are ready to talk to their doctors when they come to know the memory and the cognitive symptoms about the dementia. The lifetime risk for Alzheimer's is around 1 in 4, 1 in 5 for the women at the age of 45, and 1 in 10 at the age for the men's. 1 in 10 Americans would want to know the symptoms and the treatments available at the early stage. So, in order to treat Alzheimer's disease, we need to have drugs that can actually help us to delay the onset of the disease and slow down the progression of the disease and improve the cognitive and behavioral symptoms of the disease. However, the existing drugs that are approved for the treatment of Alzheimer's, like donepezil, galantamine, mementamine, these existing drugs, they are mostly involved into the symptomatic treatment of the disease. They do not focus on the root cause of the disease, and hence could not work on slowing down of the disease progression. The pathophysiology of Alzheimer's is actually multifactorial, which makes it actually difficult to cure and to treat the disease. So, all the existing approved drugs that are available, they do not focus on the pathological features of the Alzheimer's. These pathological features are the extracellular deposits of amyloids in the plaques and intracellular uh, neurofibrillary tangles, which are comprised of abnormal tau proteins. So it was in June 2021, the first drug, that is the first disease modifying treatment, was approved by FDA. And this was the first drug that was approved since 2003. And so if we look at the time frame, it is almost after 20 years after the memantine was actually approved. So this has been considered as a potential treatment for the Alzheimer's. So if we talk about aducanumab, it is actually a monoclonal antibody, and it is effective. It is actually selective for the aggregated forms of amyloid plaques, and it has demonstrated efficacy in the removal of the amyloid plaques. So now, if we look at the people with Alzheimer's, in their brains, they have the amyloid builds up into plaques, and these proteins, these are called as these plaques are actually thought to be toxic, and they are considered as can damage the cells of the brains. So it was almost 30 years back that the importance of amyloid proteins was first identified, and since then the researchers have been working on developing the drugs, and these drugs are known as the immunotherapies. So these, they focus or they target on clearing the amyloids from the brain. So they target the amyloid plaques in the brains and help to break down, which because of which the researchers actually believe that by clearing the plaques from the brains, they will be able to actually slow down the disease progression. Let's now understand the three potential drugs that work in this way and have been showing a promise in the treatment of Alzheimer's disease. So those three are donanemab, lecanemab, and renternotumab. So the first drug, this is the most recent immunotherapy drug, which is actually making the headlines with the release of the full results from the large final stage clinical trial. So this particular trial included 1,182 people, and they were having amyloid in their brains, and they were having symptoms of memory and thinking. This particular drug is developed by Eli Lilly. It is given to patients by an intravenous drip. So the final results that are out or are being revealed, that shows that donanemab is actually able to remove the amyloid proteins from the brain. Amyloid from the brain, and that can help in slowing down the progression of the disease. So researchers have also observed that if this particular drug is given earlier, then it will be showing better results. The second drug The second drug that we have is lecanemab. It is also an immunotherapy, and this drug is developed by Eisai. It is recently approved by FDA, and this also is given. in the intravenous by intravenous drip to patients. It is found to be effective, slowing down the progression of the disease, and can successfully remove both amyloid and tau proteins from the brains. The third that we have is Bremternatug. It is considered to be the third promising drug. It is also an immunotherapy. It also targets amyloid clearance. This one is again developed by Eli Lilly, and the hopes that are expected from this particular clinical trial is that it is more effective, and it can reduce the adverse effects that are observed or seen in other immunotherapy drugs. So this particular trial, so the trials have been showing that donanemab has 40% slowing in decline of everyday activities, such as like driving or doing hobbies and managing some finances. So if we look at lecanemab, it is around 56% reduction in the decline of the everyday activities. So these results are exciting and can be found as game changing. They are giving us an hope for better treatment options. So here, around 187 trials are under evaluation for 141 unique drugs for Alzheimer's. If we consider, there are 55 clinical trials in phase 3, which are for the assessment of 36 agents. 99 clinical trials are in phase 2, and they are for the assessment of 87 drugs. So, if we see, most common ones that are under assessment are disease modifying therapies. So, of the total count, we had seven. The research study had found that 79% of the drugs in trials were actually the disease modifying therapies. If we look at the phase 3, there are 67 drugs in the trials, which are the DMTs. Most of them are the small molecules, and 25% of this 36 drugs are the 25% are the biologics. So, if we look at the landscape for the drugs pipeline that we see, they are uh, we have hope coming in from the lecanemab and donanemab, and they have been showing high potential to slow down the Alzheimer's disease by targeting the amyloid proteins. So now let's hear from my colleague, Dr. Dinesh, who will be taking us forward in this topic. So, before we begin the discussion, we encourage the participants to ask questions to our experts in the comments section, as we strive to make this event interactive and informative. Please join me in welcoming Dr. Dinesh. He's working with Innoplexis as medical associate. He brings over 15 years of exceptional healthcare industry expertise. He'll be guiding us how early diagnosis of Alzheimer's can help patients take control of their conditions and maintain a good quality of life for themselves, their family, and the caregivers. Welcome, Dr. Dinesh.
Thank you, Deepa, for the nice introduction and for the snip list which you have shared with us. And I'm sure about this that all the audience has found it useful. So I will just take it a step ahead to it. So whatever we are going, what are the treatments available, or it will be a kind of a questions which are normally going, comes to your mind when you hear about Alzheimer's or you read about Alzheimer's. So what is this Alzheimer's all about? So I have prepared something, small kind of a presentation uh, to go through it. So it's like all the knowledge is available everywhere. I've just tried to put it in one format and try to present. So we'll go through the slides.
Sure. Go ahead.
Okay, so welcome. So first question, what is come to our mind when we read about Alzheimer's is like something dementia. So the first question that comes to our mind is what is the difference between the Alzheimer's disease and dementia? So everybody has this question in mind, but there is like a very there is no perfect answer to this question. But we'll try to answer this question by looking into the picture. So, as we see that Alzheimer's is like a type of dementia, and dementia itself is like the cause would be like Alzheimer's. So there are different kinds of dementias, and Alzheimer is one of the type of dementia. So, in short, if I want to put it, so Alzheimer's is a disease, and dementia is a condition. So both are been defined. So one is condition, one is disease, but both are not a normal part of aging. So most of the time we say that senile dementia, I will be covering that in the later half of the presentation. Dementia is something where you have general, memory, the loss of memory. You don't have the ability to think, or you lose on the creativity of that particular person. So dementia is something which we relate correlate to old age, and normally old age means like the old person has a dementia. But today's topic, what we are going to have, this can happen in an early age also. So the next question, what is the cause of Alzheimer's disease? So as I think Deepa has already covered some of the causative, what is the cause of that Alzheimer, and what is the treatment landscape is available on that. I want to just put your attention on this specific things. So you can see there's a diagram where we have a normal blood brain cells and Alzheimer's brain cells. So in Alzheimer's, there is a accumulation of the tau protein and the amyloid plaque. So if I see closely, the extracellularly, you will have the which is like the amyloid, which we are calling as a plaque, and intracellularly we have the neurofibrils, that is called tau tangles. To understand it better, we'll see a short video. I think I think that that will be very helpful for you to understand how the things go into the pathophysiology of that particular.
Alzheimer's disease. Alzheimer's disease is the most common cause of dementia and also the best understood. Alzheimer's disease is thought to be caused by the formation of abnormal deposits of protein in the brain. These are called plaques and tangles, and they are made up of two key proteins, amyloid and tau. Amyloid and tau are present in healthy brains, but in Alzheimer's disease they function abnormally. Amyloid forms plaques outside cells and tau forms tangles inside them. These plaques and tangles damage the nerve cells, causing them to die. When lots of cells die, this causes the brain to shrink. In Alzheimer's disease, the hippocampus is usually one of the first areas of the brain to be affected. The hippocampus has a vital role in forming memories. So someone in the early stages of Alzheimer's disease will often have trouble forming new memories. They may struggle to remember what they have just done or said, and may repeat themselves in conversation. More recent memories are usually lost first. while older memories can remain for much longer. Someone may remember things from their childhood better than they do things from earlier that day, for example. This is because older memories from childhood depend less on the hippocampus and more on other parts of the brain, which are not damaged as early in Alzheimer's disease. In Alzheimer's disease, the amygdala is often affected later than the hippocampus.
So welcome back. So I think that was useful for you to understand how the Alzheimer's process is goes in our brain and how it affects your thinking ability, your memory, and all. But what we are like right now concentrating or we are basically focusing is the symptoms which are due to the early, that is early part, that is our memory loss. So now,
Yes.
what are the early?
Yeah, so Dinesh, I
Yeah.
mean, the video was very much useful for us to understand what is Alzheimer's and how it is caused. But I have a question here. Is there any risk factor that is associated with early occurrence of Alzheimer's?
Yes, Deepa. The risk factor is the only genetic factor which, like we would explain, the person has a familial history of Alzheimer's disease, is having a risk or probability that he would get an Alzheimer's or early Alzheimer's in his later life, unless until he works towards it uh, for his prevention or something like that. What we can say, uh, if it is going to happen, then definitely prolonging what he can do about to prolong it.
Okay. Yeah, that answers my question. Thank you. Yeah, please
Okay.
take ahead. I mean, you can
Okay.
resume your
So
presentation.
yes. So we'll go to the next part. So what are some of the signs related to early onset of Alzheimer's? So basically, after knowing that Alzheimer is going to happen, when the person has a familial history and something, so how I should, uh, understand, or what are the signs which will make me understand that I am suffering from Alzheimer's? So if I look at the early onset part, so early onset, the typical age would be like 40 to 50s age. And the most common difficulties which may be there, like what we have talk about the memory loss, that forgetting about the material, that was like, for example, he has read something, but he just forgot what has he has read, or he may be misplacing things or losing things which you don't remember what where he has kept or something. Main thing is like while socializing, when is introduced to him, the person immediately forgets that particular what the person's name was. And it may happen to you, a common person also, when you are in a stress like situation. But considering the two factors, that if you have a familial history and your age is like in between the 40s and 50s, so definitely we need to pay attention to this kind of signs. So after, if we know this, and these are the best observed by the caretakers or the relatives or the loved ones which are there with around us. So sometimes we may forget things, but the loved ones will observe that, okay, he is having this particular problem on a regular basis. So this is a kind of a indication that we should visit to a hospital or your family physician, to neurologist or any, you to seek basically a medical help regarding the further investigation and the probable treatment which we can have. So what are the, now after once we know the signs, what are the tests or diagnosing for the early onset of Alzheimer's? So as per right now, the Alzheimer's is like in study. As you see, a lot of drugs are there, which right now in under investigation or the clinical trials. So there are very broad methodologies to classify or to have to diagnose it. First is that it should have been, there is no single test which is like, for example, when we get fever or something like that, or when we have an infection, we go for a lab test and we determine that okay, I have an infection, so I should take an antibiotic. But here it's not all about a test. It is like something, uh, kind of a combination of clinical assessment and the lab records, which is like we have to go, the battery of tests which we have to go. So first thing which comes in the clinical assessment is like medical history. So if you have a positive familial medical history, then definitely there is a chance that you would be, as I said, there is a risk factor which will have you Alzheimer's getting in into. Then there is a neurological examination which examines your higher functions and reflexes. So this is done at a clinical setup. Then you have cognitive, functional, behavioral test, where there are a set of questions, answers, and activities which the person undergoes, and the test results are being indicated. Imaging, we have brain, MRI, CT, and PET, that is positron emission test. Tomography, that is basically done for your cancer uh, patient also. So that is done right now for diagnosis of Alzheimer's. And lastly, which is like still into a research kind of, the CSF and the blood biomarkers. So these are the recent things which you can uh, conclude that the person has Alzheimer's disease, and this has to be always, in association with your loved ones or caretakers which are there. Then after this diagnosis, then the most important part, why it is important to diagnose early Alzheimer's stage, why it is so much that we are talking about today, why should we pay an attention to the early part of Alzheimer's? Because if I say the onset of that particular uh, disease is like 40 to 50s, which is very in an ideal time for every kind of adult, where he has to put his like financial or life plans, end of life plans into place, or if he has to have to have signed legal documents or something, so he has to do these things. So if it has been delayed, then once the Alzheimer sets in, then he would, it is very difficult for him to go through this whole process. Then the nature of the disease, there is no curative treatment for this, only preventive, as well as a preventive also debatable, but definitely it's not scientifically proven, but no curative treatment as such. We have treatment which is like it will slow down the progression of the symptoms and increase the quality of life for the patient. So once it is set in, we have drugs which will give the patient a chance to live his life, quality of life will increase, and he can live a longer life for with that progression, basically the disease symptom free kind of a life. But we don't have anything, and we have seen this in our initial start of the session when we talk about the nature of the treatment and what are the treatments available. So I think this covers all everything what I want to say, and I hope this was useful to you all. And what are the things which we want to concentrate on that? Thank you all.
Yes, thank you, Dr. Dinesh, for this insightful and enlightening presentation. I'm sure this session has greatly educated our users on the significance of early Alzheimer's diagnosis. Now, let's take questions from our audience. Um, the first question to you is, can a blood test detect Alzheimer's, Dr.
Yes,
Dinesh?
Deepa, we can detect Alzheimer's from blood tests, but right now it's in still kind of a research point of view, where we are biomarkers which are the essential for detection of this tau and the amyloid, the antibody against the amyloid. We can detect, but it is still in a research kind of. In a few years of time, definitely it will be, but but I will answer it to be yes.
So it's under development, and we would be having it
Soon, very soon.
soon.
Yes,
Yeah, yeah.
yes.
So the next question is there any cure available for Alzheimer's?
Right now, no cure is available because as we talk about the drug line in the start of the session, there are drugs which are targeting the amyloid formation, but it's still not there. So we have drug which can delay the basically the progression, and the patient can live a uh, like symptom
Quality.
free life. Yeah, quality of life will increase, but we don't have a curative part.
Okay. Um, we have another question, that is Alzheimer's preventable?
So this is also very debatable because since when I say that it's a prevention, so basically when you know that your family history is positive for Alzheimer disease, and you are in a kind of a job, or you are kind of a activities or daily activities are mundane, basically you're not involved in a creative kind of thing, you're not utilizing your brain as much, that what brain activity is not that much, so definitely you would be getting into. But if you indulge yourself into a creative form of activity, any learning new learnings and all, definitely it can delay it, or it can say you can uh, again it will be like something which is not preventable, but still you will be able to prolong the onset of that.
Yeah, so like adopting good quality lifestyle choices will definitely help
Yes, yes,
prolong
agree.
the disease progression.
Right.
The next question that we have is what is the difference between senile dementia and Alzheimer's disease?
Okay, very good question actually. So right now, India, like as I always think of this particular part. So senile dementia and Alzheimer's. So in India, we have a tendency, we have seen our parents or grandparents or something, those who are lived beyond 60, 65 years and all, they have a tendency to forget. So normally we call them as a, the person is like old age, so that's why he forget things and all. But if you look at clearly and see the symptoms like what he has, the memory loss is a very recent, like a recent memory loss. It's not about the long term. The person remembers the person or his relatives all throughout, who if he has seen, he has seen throughout his life. But the recent activity, for example, he has had his dinner or not, basically it will be a question coming to his mind, and that is the forgetfulness which we see. I remember my grandfather, when he was suffering by this, it was a very casual, I used to visit him, he used to recognize me, "Arey, yeah, you have come," and after few like 15-20 minutes he will again ask, "When you have come? When you arrived here?" And then again I have to tell, "Okay, I've just arrived," and just like that, you need to be polite, and just they don't should not feel awkward that I'm asking the same question again and again. So the difference between, I won't say it's a difference between, but if we investigate the senile dementia, definitely it will be something, some of the type of Alzheimer's. It may be vascular, it may be Alzheimer's kind of disease also. I hope I answered your question in this part.
Yes, yes. Yeah, we had these questions. Thank you, Dr. Dinesh, for joining us, and we hope to have you with us again in future as we continue to raise awareness about neurological disorders.
Thank you, Deepa. Thank you, all of you.
Welcome.
Bye.
So, as we conclude today's event, thank you all for participating in this engaging session. Join us next time as we delve into cognitive behavioral therapy with Dr. Mithila Desai. She'll help us understand what is CBT and how it works in elevating depression. Thank you so much. Bye.